Hello, everyone. Welcome to this webinar titled How to Write an Abstract for a Scientific Conference. This webinar is sponsored by Plus-Circle Community Health Advancement Organization, Nigeria. And to avoid distraction, all participants are muted as they join. However, you may use the hand raise icon to signify if you want to ask a question. Alternatively, you may use the chat box to send in your questions or comments. We will respond to all questions during the Q&A session after the presentation by our speaker. We're excited to have Dr. Olayinka Stephen Ilesomi as our speaker in today's webinar, and I will read his bio shortly. Dr. Olayinka Stephen Ilesomi is a medical graduate with an MSc in epidemiology and medical statistics. He also has an MBA, an MPH, and an MSc in global health policy and management, holding a PhD in public health, and is a fellow of the West African College of Physicians, specializing in community health. He has over 18 years of experience as a public health specialist, and his expertise spans health system strengthening, primary health care, disease prevention, capacity building, and outbreak response. He has supervised more than 10 PhD and MPH candidates and published more than 315 manuscripts. On Google Scholar, he has more than 99,000 citations and holds an H-index of 82 and an I-10 index of 181. He has attended and presented at over 50 conferences within and outside of Africa. He has also reviewed abstracts and presented and moderated sessions. In 2018, he was a postdoctoral associate at Yale School of Medicine, where he made significant contributions to the Liberian medical education. At the College of Medicine, University of Ibadan, Nigeria, he was a clinical epidemiologist, and he taught epidemiology, community medicine, and global health. He was also jointly appointed to the clinical virology unit of the College of Medicine's Infectious Disease Institute. He served as an honorary consultant for the University College Hospital in Ibadan, Nigeria. He is currently the West Africa Regional Program Lead at Africa Centers for Disease Control and Prevention. He is also an adjunct professor of public health at Leeds City University, Ibadan, Oyo State, Nigeria. He is the top cited researcher in the field of epidemiology and public health in Nigeria and has consistently been among the top 2% cited researchers globally. Ladies and gentlemen, please make welcome Dr. Olayinka Stephen Ilesomi.
Yeah, thank you very much, Anu Oluwapo Afolabi. I hope my volume is audible. Yeah, thank you.
Yes, it is.
So today, as mentioned earlier, we'll be looking at how to write an abstract for a scientific conference. And the outline that I'll be using is as follows. We'll have the objectives. We'll be looking at a few preliminary slides. Then we continue till we end up the session. We'll have a few minutes to take questions and answer. Now, the objectives of this session is to describe the fundamental components that make up an effective abstract. We're also going to be identifying frequent errors and misconceptions in abstract writing to avoid common mistakes. Develop skills to write clear, concise, and compelling abstracts. So at this juncture, before I continue, I would like to appreciate those that have joined, and I would also like to appreciate the opportunity to present this on behalf of Plus-CircleCommunityHealth Advancement Organization. Now, what is an abstract? An abstract is the summary of the paper. Though we call it a summary, it has to be concise, complete, and has almost everything that the paper contains. You should be able to tell us, this paper that I'm about to read, what are the things that I'm likely to find in it? The abstract should provide a brief summary of each of the sections of the paper. Now, when you see the word IMRAD, it means introduction, methods, results. The A is and the D is discussion. Though in some abstracts, or in most rather, instead of the D, we have C, that is introduction, methods, results, and conclusion. The abstract states the principal objective and scope of the study or the investigation or activities. It describes the methods that has been used in the paper. The abstract summarizes the results and states the principal conclusions. Still talking about the IMRAD component. What are the usefulness of abstracts? It showcases the beauty of the work we do. It also allows the reader who may be interested in a longer work to quickly decide whether it is worth their time to read your paper. And after reading the abstracts, the reader can make an informed judgment about whether he wants to explore more working relationship with the authors of the abstracts. Potential collaborators, they may come to your session during a conference session to listen further to what the author has to say. Most times when I go to conferences and I attend abstract sections or poster presentation or oral presentation section, I decide the session to attend based on the title and the abstracts that I've seen in the book of abstracts. Now, what are the features of a good abstract? It should be informative. The title should be informative enough. It should contain minimum of the what and where. The what means what exactly are you doing or have you done, and where was it done. The word length of abstract is usually between 200 and 350 words, depending on the conference. I think it was only once that I've ever submitted abstract of about 750 words. I think maybe the Geneva Ed Forum, and that was almost about 7, 8, or 9, 10 years ago. But these days, most conferences request for abstract of 200 to 350 words. The abstract must be written according to the requirement of the target conference, or if you are publishing your work, it has to be according to the target of the journal. Abstracts must be written in past tense, as it refers to the work that you have done in the past. You only write abstract of what has been done previously. Abbreviations, when used, must be defined at the first time that it is mentioned, and such abbreviation must be consistent. For instance, if your work was done among people living with HIV/AIDS, PLWHA, you must consistently use that abbreviation throughout your abstract. Sometimes some people will use PLWHA and at another point use PLWA without the H and so on. Consistency matters when you want to use abbreviations in your abstract. The abstract should not cite any references except in rare cases. I've also experienced, I think, 1 or 2 conferences where they said you should cite 1 or 2 articles that speaks to your abstract. In such a case, the citations will also not be in text. It will be there below the abstract. And it should never give any information or conclusion that is not stated in the paper or figures. Whatever you have not mentioned in the paper, in the results, you don't need to give the conclusion in the abstract. For instance, people write abstracts. Maybe the result is telling us that the prevalence of hand washing is low among healthcare practitioners, maybe among a particular cadre. And in the conclusion of the abstract, you now write that the government should ensure that there is pipe-borne water in all the healthcare facilities. Your results have not shown us that probably pipe-borne water was not in existence, or probably they don't have pipe-borne water. But you have said that the uptake is low. Then you should be able to give a conclusion that will speak to the uptake. Probably your results told us that, only 5% of the healthcare facilities that you surveyed had pipe-borne water. Then you can now conclude on that. And your abstract should also include keywords. Ensure that keywords are added to your abstract so that whenever it is indexed, it will be easier for people to be able to locate your work. And it also increases the number of your citation, of your references. Some people publish a lot, but if you Google their name, you hardly find their work. When you use some search terms, you don't find it because their works are not properly indexed. Now, when it comes to abstract writing, there are 2 main types that I would like to talk about with respect to the kind of study or the kind of work that you have done. You can write a project or program abstract, which will be having background, we should have rather background, the description of what you have done, the lessons learned, and also the conclusions or the next steps. But for core research abstracts, which I'll be talking about today, it usually have background or introduction, the method section, the results section, and also conclusion or recommendation. Another type of abstracts that we may want to talk about is structured and unstructured abstracts. Now, when your abstract is structured, you see the section, the introduction, the methods, the results, and the conclusion being separated, maybe separate paragraph. Some will have subtitle, background. You write a few lines, go to the methods, write few lines, results. But when an abstract is not structured, you normally have all these parts being put together without any separation. The entire abstract will just be one single paragraph. Now, this slide is talking about the abstract sections. Normally, we have the title, the introduction or background, the methods, results, and conclusion. Mind you, I'm talking about a research-based abstract, a full research, core research, not just programmatic or project abstract. Now, starting from the title of the abstract, a good title is defined as the fewest possible words that adequately describe the contents of the paper. The fewer it is, the better. In some institutions, they have maximum number of words that you can use when you are writing the title of your manuscript or your abstract. Some not more than 18. For some, not more than 22. And I even want to add that this number of words are somehow long. It's better you reduce it to the minimum so far you have the what, the where, and if possible, the when. I will talk more about this in a moment. So the title is important and must be carefully crafted. An improperly titled paper will get lost and will never be read, or it will never be cited. If you have done a manuscript and you have studied probably people that were tested positive for Mpox, and rather than putting Mpox in the title, you just put rashes, for instance. At some point, when people are searching for work done on Mpox, they may never find your work, and such work may never be cited. Still talking about the title of a manuscript, titles should neither be too short nor too long as to be meaningless. The shorter it is, the better. At the same time, you don't want it to be too short. Waste words should not be found in the title. A few researchers, especially early career researchers, they are fond of using words like studies on all the things, all the manuscripts or abstracts that you are presenting. They are as a result of a particular study that has been done one time or the other. So when you are now saying the study of persons living with HIV/AIDS in Nigeria, you may not really need to put the word studies in the title. Some may want to write investigations, for instance, investigations on the prevalence of maybe dermatitis among patients tested positive for Mpox. Now, the investigation in this title may not really be necessary. At some point, they may. And the use of probably a study and exploration, this kind of words should not be used in the abstract. You just make it as short as possible. And it should contain the keywords that reflect the content of the paper. Before you formulate your title, ensure that your keywords, just like I said, if you have studied those who tested positive for Mpox virus, and you did not put Mpox in the title, you put rashes and some other symptoms, it may be difficult for people to identify or to be able to get your work cited when they want to cite it. Even when they want to read, they may find it difficult to find it. It may be difficult for them to identify. And the title should be meaningful and not general. Make it meaningful. Don't overgeneralize. For instance, Maybe you have done a study, maybe you will write the title as hygiene of patients tested in a tertiary hospital. That's like too general, not concise enough. What level of hygiene did you measure? Is it just hand washing? Is it the use of face mask? Is it the use of hand sanitizer? What exactly did you measure? You need to put it. Where was the study done? If possible, when was the study done? What kind of patient did you study? All these are necessary. You should be concise, be specific, and be informative. Sometimes, when I've been able to assess abstracts for conferences, several conferences in the past, some of the conferences, as part of the criteria for assessment, you score the title, you score the introduction, the methods, the results, and the conclusion. All these are scored. So if you have written a good body, I mean in terms of introduction, methods, the results, and conclusion, but the title is poorly written, you will lose some marks. And at the end of the day, you may not score enough points to be able to attend the conference. Now, you should be concise, specific, and informative. Ensure that you capture the fundamental nature of the findings. Now, there is one more thing that I would like to add to this. Now, before you attend any conference, most times call for abstracts are usually advertised. And when you see this call, probably there is a call for abstracts, and the study is on primary health care. But you have done your study. Your study was done maybe among a group of patients attending a primary health care facility. But primary health care did not surface in your title. That may affect your chances of being invited to make your presentation. So you must also be able to go through the title, the theme for the conference, or the themes as advertised by the conference organizers. So look at the themes and ensure that the keywords for the conference appear in the title of your work. If you do this, your chances will be increased. Now, let's look at this sample research title. This was, I think, a manuscript published by one of my colleagues and I think about 3 or 4 of us worked on this. The title is Food Insecurity and Associated Factors Among Households with Under 5 Children in Slum Communities in Ibadan, Nigeria. Now, from this title, we can find the words. The words in this title is food insecurity and associated factors. Now, the where is in Ibadan, slum communities in Ibadan, Nigeria. It is not just anywhere in Ibadan. Most of the places in Ibadan are not slum communities. We have just very few slum communities. So this is telling you that this work is going to be precisely about those residing in slum communities. So that the findings of the work, you don't be thinking that, is this how all people in Ibadan, is this how they are? No, we are talking about a particular community. Now, you have seen the words. What is this study about? It's explicitly written in the title. Where is written in the title. Now, part of what is missing is when this study was done. And I told you earlier that the when may not be compulsory, but the where, the what, and the where, those two things, compulsorily, you must include them in the title of your research. Now, let's go through how to draft the title of your abstract before we move on. Make a list of the most important keywords. The keywords are from the work that you have done. What are the keywords? This work. For instance, the previous example I gave, under 5, slum communities. Ibadan may not really be a keyword, but it may sometimes. Slum community, under 5, and then let me go back and see what else. Food insecurity. I think the food insecurity seems to even be the most important keyword in this title. Under 5 children, slum communities, Ibadan, Nigeria, maybe not. Now, think of a title that contains these words. The title could state the conclusion of the paper. How? For instance, in this work, let's assume that I want to go back to the title, food insecurity. Let's assume that malnutrition was found as a result of food insecurity. Then the title may contain malnutrition among households, or malnutrition in households with under 5 children in slum communities in Ibadan. Let's assume that the conference I intend to send this abstract to, one of the sub-team is on malnutrition. Then I will not use food insecurity. If the finding of my work shows that, oh, the prevalence of malnutrition is high among this group of people, then compulsorily I must add malnutrition to my title because I found it at the end of the day. So the title of your work, of your paper, of your abstracts can also be influenced by the theme of the conference that you are attending. The title never contains abbreviations. Try not to use abbreviations. How about if your study is among patients living with HIV/AIDS? I think it's better you write it in full in the title. Chemical formulas, don't add it to your title. Proprietary names or jargons that may not be clearly understood by many, don't add it to your title. Always review your title before submission. Review it over and over, based on your findings, based on what you've done, where you did the work, what you have done, and also based on the theme of your conference or the conference that you're attending. And be very careful of the grammatical errors due to faulty word order. You may misplace some words. For instance, in the previous example, let's say you start from slum communities in Ibadan, food insecurity among them, and among under 5 residing in, those are words. I'm just trying to confabulate. They are words that are not necessary. They are not useful. So use all this to ensure that you have the best title for your abstract in order to improve your chances of being invited to a conference. The first conference I ever attended, I got part sponsorship because my paper was accepted for an oral poster. Some of my colleagues who had better abstracts, they were fully sponsored. So for you to improve your chances of being invited for oral presentation, your paper must be in tune with the conference, title and themes, and also it must be well written using some of these tips that are being shared. Now, let's go to the introduction. You can call it background introduction. However, background and introduction are not exactly the same. We don't really have enough time to go into the details of differentiating and saying which one is better, which one is not. But so most conference organizers usually put one of the two, that either your background or your introduction. The background, more or less, is part of the introduction, but the background is not as exhaustive as introduction. I think I want us to leave it as that. So the introduction or the background account for 10 to 50% of the entire abstract length. If you are writing an abstract and you have almost half of the abstract as introduction, it's like you have built a house and the entire house is made of windows and doors. Then your secrets, or you can't hide yourself in such a place. So the introduction should be like 10 to 15% of the entire abstract length. It must provide a context for the project. What problems did you identify that led to the design of the project? What did the project aim to achieve? You must be able to justify what you have done in the introduction, and you must be able to tell your audience why it's important to talk about this issue now. The aim or the general objective. How do you craft the aim or the general objective? You modify the title. Your exact title, you modify it. Once you do the modification, it gives you a general idea of how your objective should be crafted. Now, when I started learning how to write, I see introduction or background as 3 sentences. Sentence 1, background. Sentence 2, problem statement / justification. Sentence 3, general objective. Now, from the same study that I shared the title with you, this is the introduction of the abstract. Let's read it together. Food insecurity is a leading cause of childhood morbidity and mortality. That's sentence 1. This study assessed the prevalence of household food insecurity and its associated factors among under 5 children in Ibadan, Nigeria. Now, the word urban, the word slum, and some part of the title disappeared from this objective because of the constraint of the number of words to use. Now, the first sentence telling us food insecurity is a leading cause of childhood morbidity and mortality. This is more like a background, like a justification for the study in a way. So just like I told you earlier, that when I started learning, I usually think of introduction as 3 sentences: the background, the justification, and also the objective. Once you have this, you can, it is even almost possible to have it, it is almost impossible rather, to have it as a single sentence. So the minimum you can have is 2 sentences. However, for some journals, if you are planning to publish your work in some journals, all they want in the introductory section is just the objective. You just start with this study assess the prevalence of household food insecurity and its associated factors among under 5 children in Ibadan, Nigeria. However, you should tune your background or your abstract to the request of the conference that you are sending your work to. Ensure that you look at the instructions for people that are submitting abstracts to that particular conference. There is no single conference that you won't have instructions for author. Even if you want to write your manuscript for publication, there are always instructions for authors to adhere with. Now, we are going to move to methods. The method contains 60 to 90 words, about 35 to 40%, not up to half. There is no single part of the abstract that should take 50% of the total abstract length. That's just what I want you to learn from here. And the method should contain words like who did you study? Where was your study done? What was done? When it was done? All these components are very important in the methods. Now, if you have to part with one, I always tell people, when you look at what is important, the next thing to look at is what do we part with? If you want to part with anything, you can part with when, provided the abstracts, the authors or the people who made the call for abstracts, provided they have not specifically requested for it. Now, the methods should include an innovation, intervention, trainings, if conducted. If you have introduced an innovation or interventions, or you have trained some people, all this must come in your method or must appear. Important to include who the trainers were, if there was any training done, length of training, number of participants, and who were the participants, if your abstract is training focused. Now, if you have identified or you have used secondary data source, you must be able to tell us, where did you extract the data from? Maybe it was from the Nigerian Demographic Health Survey, or you extracted data from the website of the Nigerian Center for Disease Control and Prevention. Probably you want to look at trend in reported cases of mpox in Nigeria in the last 5 years, and you go to the website of the Nigerian Center for Disease Control and Prevention, and you look at the trend. Maybe you want to compare it to another country, like maybe Demographic Republic of Congo, and you go to the website of their National Public Health Institute, you download their data sets, and you analyze. These are called secondary data because you were not the one that primarily collected it for your research work. They were collected primarily for the purpose of their collection was to inform the public about cases that have been detected. But you want to do some comparison. You want to do some novel analysis so that you can make some conclusion on some part of the outbreak response. Now, the software that you have used for your data analysis, it is good for you to add it to your methods. Oh, Excel, we used Excel. And when you are using any software, try to tell us the version. Because some data, some version of some software may not be able to do some form of analysis, so that people may be able to resonate. And one of the reasons why you are writing your method section is because some people may want to repeat exactly what you have done in another location. So they can learn from your work. You want to impact others through your work. So it is good for you to add the software that was used for your analysis. Now, the same study that I showed us the introductory parts and also the title earlier on, this is the method part of the work. And you can read it yourself. They are not in bullets because I just copied and pasted them from the abstracts. So this was a cross-sectional household survey of 1,027 under 5 children and their caregivers in urban and rural slums in Ibadan. That is talking about the study design, who you have studied, where the study was done. We used an electronic interviewer-administered semi-structured questionnaire adapted from the Nigeria Demographic Health Survey and Household Food Insecurity Assess Scale to report socio-demographic characteristics, food insecurity, and anthropometric measurements. So now, if you want to repeat this study, for instance, if you are residing in Anambra State, for instance, in Nigeria, and you also have some slums in the urban area or some rural slums, you can easily go to the source, Nigeria Demographic Health Survey and Household Food Insecurity. These are available, the questionnaire they have used, they are all available online. Now, the household food insecurity scale consisted of 9 questions graded from 0, that is never, to 3, often computed to determine the presence of food insecurity. So this is telling us exactly how the questions were used. Nutrition indices were computed and the results were classified according to the World Health Organization 2006 cutoff points. Chi-square tests were used. Sorry, before I go to the test. Now, all these, you can go to World Health Organization websites and search for their nutrition indices. So what am I trying to say? Your method should be written in a way that someone can reproduce your work without hiding anything. Chi-square tests were used to assess association between food insecurity and independent variables. What are the independent variables? Maybe the sex, the age, the other factors, the parents' level of education, and so on. Binary logistic regression analysis were conducted to identify the predictors of food insecurity. Alpha is 0.05. Now, this particular abstract is about 30 to 40% of the entire manuscript, of the entire abstract, rather. So I mentioned earlier that don't write, there is no single part of your abstract that should be 50%. No single part should be up to 50% of the abstract. So this abstract has shown us where the study was done, what was done, where it was done, the kind of study tool that was used, how the analysis was done, or how they were done, the analysis tool that was used. What else can we find in this study? The type of analysis that was done, and also the sources of the questionnaire, and so on. So all these are very important. Now, let's assume that your conference requested for abstract that is maybe 250 words. You may not be able to put all this. Now, that is when you need to you need to come to the conclusion that what can I part with? Now, in this particular abstract, if I want to part with some part of the abstract, now I may decide to part with electronic interview administered semi-structured questionnaire adapted from, now I can stop it there and say that electronic interview administered semi-structured questionnaire were used and stop it there. Now, adapted from Nigerian Demographic Health Survey, food insecurity assess scale, all this, I may need to part with that. Now, the other part that I think I can also part with, nutrition indices were computed and results were classified according to World Health Organization 2006 cutoff points. I may want to say that, the standard these were used and the like, instead of putting the details. But if you have more than 250 words, then it is good that you add all this if it is possible. So now, let's go to the next part, which is the results. The results should also be like 80 to 90 words, like 35 to 40% of the total abstract length, maybe about 35 to 40%. Now, when you look at an abstract, before I go on, the most detailed part, or the part that should have the highest number of words, that part may be methods. The methods and then followed by the results, or either of the two. But I used to advise people to write more in the methods because you want people to understand the work. You want them to be able to resonate with it very well. And the way to be able to do this is by understanding the methods section. Next, you can go to the results, which should be the next part. But for your conclusion and for your introduction, even most times the conclusion should be the least part, or in terms of the number of words, except if the conference organizers have specifically indicated that you should do it otherwise. Mind you, the conference organizers, you should stick 100% to their requirements or to their rules and regulation, regardless of, let's assume, for instance, you are writing for a conference and they even tell you that you should put your methods before that you should write your methods after your results. That is not possible. I'm just thinking of something impossible or ridiculous, rather. If they say that you should write your methods after your conclusion, please stick to that instruction, though that is ridiculous anyways. What I'm just trying to emphasize is the fact that you must adhere strictly to the instruction of the conference organizers. So results should be measurable. Results should match the objective stated. Whatever you have told us that you want to do in the methods, you must tell us the results. You must be able to show us. And in your background, whatever it's like telling a story. You must be consistent, sequential. One step must follow the next. Just like those days in high school or secondary school that will write how I spent my last holiday. You won't start from the day of the school resumption. You start from the day that you started the holiday, then the following day or the next week. So you won't go from the end to the back, depending on the style of writing. So you must ensure consistency. Results should be measurable, include data. Objectivity should be maintained. Follow your objective and ensure that. Now, for the same abstract that we have been looking at, this is the results section of the abstract. The mean ages of the caregivers, mind you, we studied under 5 children and caregivers. Now, you need to tell us about them. So the mean ages of the caregivers and the under 5 children were 31.7 plus or minus 7.47 years. That's for the caregivers. In years, the units are very important. And the children, under 5 children, their mean ages 34.49 plus or minus 15.8. Now, let's assume the month was missing. Then the abstract is not going to be understandable because you need to show. You said caregivers are adults. The children, they are under 5. So you need to put the indicators that what are you studying. Now, respectively, overall, 530 children were female. That is, female were slightly more than the. Now, in your research, in your abstract results, you don't have to be telling us that children, females were slightly more than. No, tell us the results. You don't say females are slightly more. People want to see results. They want to see figures, facts and figures. Tell us what you have found. Now, overall, 530 children were females, and 74.5% had normal weight for height. We use weight for height for children under 5. Now, in all, 195, that's 90.9% households had food insecurity, while 832, which is 81.0% household, had food security. Now, if I don't have enough, if I don't have words that I can play with, instead of saying 90% had food security and 81% had 90% had food insecurity, 81% had food security, it's like saying that 20% said yes, 80% said no. You don't need to repeat it. But mind you, this abstract was copied from a published manuscript, and it was published in BMC Public Health. So the reviewer insisted that it must be mentioned. If not, just mentioning that 90% had food insecurity should suffice. Now, let's move on. Under 5 children living in urban slums were 7 times more likely to experience household food insecurity compared to those in rural slum. This study was done in urban and rural slum. Under 5 children living in urban slum, that means in the urban slum, they have more problem than the rural slum. So now the adjusted odd ratio, this 7 times is telling you about 6.859. That's the 7 times. And the confidence interval is there. The p-value is there. Mind you, if you are writing an abstract, you may not even need to put p-value here, because merely looking at the confidence interval, a scientist will be able to tell you that this is the p, whether it is less than 0.05 or not. So there are some repetitions based on the request of the reviewer. So if you are, and I think the abstract for this manuscript is about 350 words, but most conferences will not give you that luxury of words. So you need to know what is compulsory, what you may or may not add, and what you should not. That is very important. Now, moving to the conclusion, which is more like the last part of the work. Now, some conferences will request for the public health effects of the work, which I will advise you to add to your conference presentation if you still have some words to play with. So results are not the same as conclusion. They are not the same as discussion. In results, people want to see figure. 90% add household insecurity. 10% add this. Rather than telling them that few cases, what is few? People may not understand. High number, maybe what is high? You don't need that in your results, but in your discussion, you talk about what you have found. And as a guide, the discussion should account for about 10 to 15% of the entire abstract length. I told you earlier that prioritize using higher number of words in your methods and then followed by your results. The discussion or the conclusion and the introduction, just 10 to 15% for both is okay. Maybe 20% for introduction, 20% maximum 2 for conclusion, or 10 to 15% is ideal. Do not leave the interpretation to readers. Whatever you have found in your results, interpret it. What is the meaning? Now, if I tell you that 10% add household insecurity, is 10% high? Are you bothered? Are you worried? Are you concerned? You should give us this in your conclusion. If you still say it's that, oh, 10% add household insecurity, food insecurity, and you are repeating the same in your conclusion, that means you have not told us what the interpretation of your findings, what they are. Draw your conclusions logically, and don't overestimate your results. This study was done in a community which is an urban metropolis in Nigeria. The study was done in Ibadan. Ibadan is a state capital. It's one of the biggest cities in Nigeria. Now, if you have done your study and you found that in a particular area, you can't generalize this work to the entire Oyo state. Ibadan is the capital city of one of the states. In Nigeria, we have 36 states and the FCT. Now, you cannot generalize the finding of this study, which was done in a slum community in Ibadan. Ibadan is a metropolis, a city, a big urban city. Then you did a study in the slum community. The entire Ibadan is not slum, for you to know, because you did it in a slum community in Ibadan. You now say that, oh, 10% of the people living in Ibadan, they are having food insecurity. No. You have overestimated your results. You should write your results based on your finding. The fact that you have studied the urban slum, and you are now trying to tell us that people, the government, maybe you want to write the public exhibition, what the government should do, what should be done. You are now saying that government should distribute free food to everybody in Ibadan. That's not from your results. So let's move on, please, because of that time. Now, this is the conclusion from that same the abstract that we have been looking at. Household food insecurity was more prevalent in urban slums. Strengthening of the school health program would help identify children with nutritional deficits and improve the overall health status of children living in slum community. Now, this finding is from the results. Now, there is a comma or a clause that I have. The authors, including my humble self, mentioned strengthening of the food health program. Now, so far, was there any reference to school health program in this study? If there was no reference to school health program, the only way that reference to the school health program could be justified was that in the study, school health program was targeted or was part of the finding. maybe whether it was high, whether it was low. But mind you, if I need to part with anything in this conclusion, I will not mention school health program. I will just proudly mention how food insecurity can be reduced in that same community. Now, these are the take-home points. I'll be rounding up, finishing in the next few minutes so that we have some few time for question and answer. Read the instructions provided by the conference organizers. Read the instructions over and over again, because it's like someone has given you marking scheme. I've heard of a joke that somebody went for an exams and the instruction is that answer question 1 and then go to the last question. And this might be my friend, my very brilliant friend, started from question 1 and there are 10 questions and started answering. Finish question 1, 2, go to 3, and then the person has answered question 1 to 8. And the person ends up scoring less than 50% because the examiner marked only question 1 and then was looking for question 9, the answer to question 10, and it was not found. So, and the average students who answered question 1, read the instruction very well, moved to question 10, and ended up scoring close to 100%. So, reading the instruction provided by the conference organizers is very, very important. Give adequate time to writing and go back to the proposal if you need be. Go back to what you said you want to do. Go back to your method. Go back to what you have done. Go back to what you said you would do over and over again. When you do this, it will help you to be able to stick to the instructions or the guidance of the conference organizers. Read examples of abstracts from well-known journals, conferences that report findings from projects. Ask your peers to review and revise as required. Now, this last bullet is very important. No matter how good you are, whether you are an early career starter or you have been writing for over 10, 15, 20 years, you still need to review and revise your work over and over. Once you look at your finished writing, give it to, the person may not really be as sound as you are when it comes to research, but you need a second opinion. It is 100% mandatory. No matter how sound, how good you are, you need a second. The fact that you are sharing your work for others to review, that doesn't make you less intelligent. No. The reason why you are sharing it is you want them to point out things where you need to improve. So let's ensure that we share our work with others, and this is very important. This is my last abstract. Do not add a reference list or in-text citation to your abstract. Do not report results that does not speak to the stated objective. Do not write in future or present tense, write in past tense. And do not conclude your abstract using information that cannot be garnished from the results section of your abstracts. Ensure that you write based on what you can find in your results. That's what you conclude on. So I would like to thank you for your attention, and I would like to appreciate Plus-CircleCommunityHealth Organization, Advancement Organization, for organizing this for us. So back to you, moderator. This is a reference that was used for the abstract sample that was used is from this study. So thanks to Dr. T.M. Odenidi, who was the lead author in this publication. So the moderator is also a co-author, and I'm a co-author also. So back to you, moderator.
Thank you very much, Dr. Ilesomi. We appreciate that amazing and insightful session. So we'll be taking questions now. We've collected about 3 questions posted by some of the attendees, but we have Mr. Rashid's hand raised, and we'll want to take his question first. Mr. Rashid. Okay. A minute, please. Okay, please unmute and speak.
Okay. Good morning, colleagues. Good morning, Professor Ilesomi, for this wonderful presentation. My name is Rashid, and thanks for this opportunity you are giving to us. Just for the sake of clarity, I myself have, turned in 1 or 2 publications before with, CDC Affinet on GIGS project. So, and I remember when we were writing that abstract, in fact, that was my first time of writing, a co-writing, an abstract to Elena Project Foundation in Botswana. So there was this last section which mentioned statement on conflict of interest, which was not mentioned by Professor Ilesomi. I don't know whether that is a basic criteria for abstract writing or not. It didn't mention of that statement on conflict of interest. Is it mandatory or not? And secondly, I meant to know that an abstract is a subset of manuscript, right? And I know that most manuscripts are between 25 to 40 pages. And the abstracts, they'll be asking mostly, right, ideally, maybe one paragraph in 250 words. So I want you to, enlighten us or guide us. What are the major components of this abstract we are going to put in together to have one paragraph, in a manuscript of 25 pages? Thank you, Anova.
Okay, thank you very much, Mr. Dr. Mr. Rashid. Okay, I don't know which title is more appropriate now. Dr. Elesome, would you want to respond to that comment before we take others?
Yes, thank you so much, my friend Rashid. Now, talking about conflict of interest. Now, at the stage of your abstract submission, most conference organizers, they normally specify if there is any conflicts of interest. For instance, if I've carried out a study that shows that the use of a particular supplement can reduce hypertension, and the name of the supplement, maybe let's just call it supplement A, and my father is the owner of the company, and I've shown that 90% of those who use supplements A, they have their BP well controlled. Now, I need to ensure that conflict of interest is identified, because let's assume I'm a student, my father is the one sponsoring me in school, and is the supplement A that I've tried to present is the products of my father's company, or I work in the hospital. Maybe there's a drug produced by one of these popular pharmaceutical company in Nigeria, and they have sponsored me to conference. They've paid for my trip to attend the conference in the past, or even this conference, they are the ones sponsoring me, and I'm telling you that their product is the best in Nigeria. So I need to ensure that I disclose such conflicts of interest. Before you present your paper in the conference, most times they normally send some conflict of interest form that you need to sign, so that even though I am saying this product is the best, however, I work for the same company. They are the one paying your salary, and you are now saying that their product is the best. So people should take your findings with a pinch of salt. So that's one thing. But if you are doing a study that is just a descriptive study, then conflict of interest may not really be applicable. But once it is experimental, clinical trial, and so on and so forth, it is always compulsory. Now, about the one paragraph abstract that my friend Rashid mentioned. Now, I mentioned when we started that we have structured and unstructured abstracts. And I told you the IMRAD guideline, IMRAD, that's introduction, method, results, and the discussion/conclusion. Now, whether your abstract is structured or unstructured, I will advise you that when you want to start writing your abstracts, write structured abstracts. Now, if the conference organizers are requesting for unstructured, which is rare, most conference organizers request for structured abstracts. So if they are requesting for unstructured abstracts, then you can collapse it. Put your introduction and the methods, result, and conclusion. Put it together as a single paragraph. But it's better not to start from there. Start your abstract as a structured abstract, then you can now collapse everything. So thank you so much for the question. Back to you, moderator.
All right, sir. So we have a couple of other questions listed here, and some of them are okay, so this is from Dr. Bashir. He's saying, how should one approach writing an abstract for a study that is still in progress, especially if the results are not yet finalized?
Okay, thank you, Dr. Bashir, for the question. I want to assume that maybe it's a project research. Now, you can fragmentize or compartmentalize your work at some point. For instance, if I'm carrying out a study among patients living with HIV/AIDS who are taking medication at the National Hospital, Abuja, for instance. Now, let's say the first part, I've written the proposal, and the first part of the study is community entry, which is actually not really a study. I want to go to the CMD of the hospital to inform. I've gotten my ethical approval. Now I want to go to the CMD of the National Hospital Abuja because I'm using the hospital. And I also want to talk to the doctors that are managing the patient living with HIV/AIDS. Now, when I got to the CMD told me that, oh, we will allow you to do this work in National Hospital, but you need to talk to the doctors in charge of the clinic. Now, I've gone to the doctors in charge of the clinic. For instance, let's assume that the doctors are having industrial action. Maybe they are on strike at that point, and the study has not started, and so on. Now, and you want to submit an abstract, you may write about commencement of a project on people living with HIV/AIDS. So the experiences that you have gathered as a result of the implementation of the project, you can share it with people in the conference. People can learn from your experience. Maybe if you had gone, let's assume that you got to the hospital, you did not talk to the doctors, you went straight to the clinic where the patients are being managed, and you now faced some challenges. The patient said you are not one of their doctors, and they are not going to talk to you. I'm just saying this. The patient said, no, where are you from? You introduce yourself. My name is Dr. Bashir. I work with, maybe you work in another hospital, or I work with the Nigerian the Nigerian Institute of Medical Research. We want to conduct this study. By the time you are talking to the patient, they are saying, no, I don't have your time. Now, you now notice that you have some hiccups. You now went back to the doctors, and the doctors now introduce you to the patient, for instance. This experience, it can be shared with people. I participated in a study sometimes back. It was a funded project. And at the time that we had the study, there was a strike. Okay, I think it was the COVID-19 time. The study was not on COVID-19. So the institution that I partnered with for that grant. So there was strike. Most of the doctors were not coming to the hospital because they don't want people to be too many. The students were not on campus. And we wrote it up, even though we've not published it. It was part of our report that we sent to the people that gave us the grants. So you can start from there, and then your study also, maybe you've started collecting your data. The little you have collected, even though you are not analyzing the full data, you can share it in conference. So that's the way to start that. Back to you, moderator, please.
Okay, thank you very much, sir. Before we take Dr. Biodun's question, there is another question here. What if you conducted a qualitative study, e.g., an ethnographic research? How do you resolve the inclusion of data in your results or conclusion? I repeat, what if you conducted a qualitative study, e.g., ethnographic research? How do you resolve the inclusion of data in your results or conclusion? And I would like that you take the response for that with the response for this other question. What modifications should I add for an ongoing research? Did you get that,
Okay,
sir?
thank you. Yes, please. Thank you, colleagues, for the questions. Now, when you are conducting a qualitative study, the finding of your work is your results. Qualitative study, I know that you don't need to tell us that 10% of the respondents, for instance, in the example I used, you don't need to tell us that 10% had food insecurity. No, you are telling us that food insecurity was one of the problems found among the respondents. That is enough. Do you understand? You don't need to tell us that, 50%, just the way we presented results in figures. Your result is your finding in qualitative study, and it is very important. Once you submit for a conference, the conference will also want to hear your findings too. So they want to hear more about your study. So it is not all the time that you have results in figures, like 10% of the respondents had hypertension. No. So if you have done a study, like I did a study with one of my senior colleagues some years back, it's on the use of contraceptive among elderly women that are like from age of 35 and above. So, and I did part of the qualitative study, and part of my finding was that some of them their kids have started giving birth and their husband felt contraceptive is not for them. And some of them still have unexpected pregnancy, even though they've stopped childbearing. And you will report it the same way. So now the second question is that how do you modify your study and so on? Now, I want to assume that the person is asking for a study that is still ongoing. That's how do you modify your study? Now, before you start your study, you have your proposal. And if you need to modify your study, it is good for you always to do like a pre-test for your study to get your study instruments in place, so that the problem of modifying the study when the study has started is just like changing the goalposts in the midst of the match. That's never, they don't do that. So now, once you have started, before you start your study, test your instruments, do a pre-test. A pre-test, if you want to administer let's say 400 questionnaire, it is advised that maybe 5% of the number you administer it in another location so that there won't be contamination. People that you want to administer your questionnaire to, they won't be contaminated by what others have heard about your study. If you want to do a study, for instance, in Abuja, maybe Abuja City, then you can go to another place, maybe in the Southwest, or maybe another population, maybe Kogi State. They are similar. Now, once you have tested the instruments and there is a need for you to modify, you do your modification. And even before going into the expanded study, you may even want to do like a pilot study, whereby you start and finish the study in another location also, or one of the location, but you do a small scale study. So you can do all this so that by the time you start your study, you don't modify your instruments again. You use it as it is. But when it comes to modification, I want to assume you do your study, you have turned in your results, you can recode. At the step of analysis, you can do some recoding. It's not that you are modifying in the modification sense, but you are recoding so that your results will be able to present your results in a way that people will understand. So thank you. Back to you, moderator.
Okay, thank you very much, sir. We'll take Dr. Biodun's question before the last question that was posted. Dr. Biodun, over to you.
Thank you very much. Am I audible, please? Okay, thank you very much, Prof. Ilesomi. If I can credit anyone that has gingered me to go into research, as I've done today, I think I would credit that to you. I've gained a lot from you. So I want to ask this question. It so commonly happens that after a conference where you presented an abstract, you may be asked to submit a full-length manuscript of the work you have done. So is it advisable or is it acceptable to submit a modified abstract? A modified abstract as part of your manuscript. I mean, an abstract that is maybe fundamentally different from the one you presented during the conference. Now, I'm saying this because I presented an abstract recently in a conference, and then I noticed a small mistake in one of my results. So I did the computation again, and I felt the onus lied on me to correct the mistake in my manuscript, sorry, my abstract, and put it in the manuscript we're asked to submit. So I want to know the ethics, if any, around this issue. Thank you very much, sir.
Yeah, thank you so much, Dr. Biodun. I think I appreciate your kind words and words of encouragement. Now, when you present your abstracts in a conference, you can, at the end of the conference, most conferences, people will come, they will ask you questions. They will guide you further. They will tell you, oh, this is what you should have done. Why didn't you do this? Why didn't you analyze this? Now, the importance, or one of the importances of this is to you are able to modify your work and improve it further. So there is no rule stating that once you have presented your abstract in a conference, that when you want to publish the manuscript, you can't modify it. You can go, in fact, you can turn it around 100% if possible. So there is no rule that says you should not do that. Now, what I do, let me just tell you, is that most of the conferences that I attend, I normally write almost a full draft of my manuscript before sending my abstract for conference. You may not be able to do that. My first conference, I did not do that. I started with almost only abstract. So if you do that, it's also shorten the time between your conference attendance and when you send out your work for publication. So that immediately you come back from the conference, while you are still in the euphoria, looking at the pictures. Oh, I met this person. I snapped with this prof. I saw this person. Oh, the WHO country rep was there, this and that. Before the euphoria winds off or fade away, you'll be able to look at, you go back to your draft manuscripts, then all the instructions or guides that you have received, the revision, you can use it to turn around your manuscript. For instance, you have done your work and you did only bivariate analysis, and you are presenting in the conference that on 10% had food insecurity in the urban area. And this, now maybe somebody now looking at it, that why can't you, instead of looking at urban area as one, why can't you stratify that the rich, that based on their wealth index, that those who are richer in the urban slum and those that are poor, can you look at the food insecurity among them? Then, oh, that's true. I should have analyzed it based on this stratification. Then you go back, you reanalyze, and you now add some nice findings. You can even send that one to another conference. So there is no end. We keep on learning. Once somebody will look at your work, why don't you do it this way? And you do it that way. And you notice that, oh, this work is actually better like this rather than the way I presented it earlier. You can resubmit such abstract for another conference, modify your manuscript before you send it out for publication. So thank you so much once again for your kind words, Dr. Beldun. Back to you.
All right, thank you very much, Dr. Ilesomi. So we have two more questions, and the first is this: if a conference gives 3 different abstract submission options, namely 1, policy or implementation project abstracts; 2, article or commentary; 3, research abstracts. Now to the questions. Question 1, will I also report the article or commentary in past tense? And question 2, I have organized the community outreach. Okay, I have organized the community outreach intervention in a community. Which out of the 3 tracks should I write on? Did you get the question, sir?
Thank you so much. Now, the person said they have a track on policy or implication or implementation, article or commentary, and research. Now, the report, should it be written in past tense? Yes. A study that has been done, even if your study is still ongoing in phases, you should report what you have done so far in past tense because you've done it already. Now, asking about if your study or your research work is a project implementation, the abstract that we do, the guideline we looked at today, is actually on full research, though the differences are not much. Now, if your study is on a project report that you have done or activities that you have carried out, now you can use the project implementation track if it is available. But some conferences, it is only research track that they have, and they use it for both. But if the conference organizers have separated research or program abstracts into different tracks, you need to follow the instruction. But if they have policy or implication or implementation research, then I think you should go with that. Program implementation track, you should go for that one, so that you won't reduce your chances of being accepted to come and present in the conference. Thank you. Back to you, moderator.
All right, sir. So a few other questions came in, and I would like to take them together so you can respond to them at once. Okay. Thank you, Dr. Ilesomi, for your insightful presentation. I would like to ask if it's necessary to obtain a written ethical approval for a descriptive, non-invasive study from an institution, or just the consent of the respondents is just fine. That's the first question. Now, the second question says, Is it allowed to submit same abstracts for multiple conferences? Is it allowed to submit same abstracts for multiple conferences? Then question 3, the last. Please, is there a recommended time frame within which data should be used for abstracts or publication after it has been collected? Is there a recommended time frame within which data should be used for abstracts or publication after it has been collected? Those are the questions, sir. Over.
Okay, thank you so much once again, moderator. Now, the first question is if it is necessary to have ethical approval or consent. Now, I will advise you, whatever the study that you want to do, please get ethical approval. It is better like that rather than just consent, because the reason why you get ethical approval is also because of ethics itself. Whether your study is cross-sectional study, not a study that is invasive, you should still get your ethical approval. And I did something at the peak of COVID-19. I started the response. When the response started, I was in Lagos State, and I needed to do some research. I wrote to NIMA to request for ethical approval. As the outbreak continues, I went to Ondo State because I needed to do some work there. I did some training before they started having cases. So I did some training for healthcare workers at the Ministry of Health before they started their treatment center. So I got ethical approval also from Ondo State because I knew I was going to do research there. Now, after that, I was in Oyo State. I got ethical approval there from the Ministry of Health because I had some studies to be done. Now, in the course of the response, I had to go to Kwara State for some IPC training and the like. I got ethical approval from the Ministry of Health. So I had 4 ethical approvals. And from the 4 ethical approvals, I published up to like 82 manuscripts. From Lagos, data I collected, study I did, Lagos, Ondo, Oyo, and Kwara. So from the 4 area, I did. So try to get ethical approval. It is compulsory. Please, it is important. The second question is, it allowed to submit same abstract to multiple conferences? I will tell you no, no, no. It is not allowed. But what can you do? Let me give you a guidance. Now, you have the abstract is just about 250 words. And the entire work that you have done, for instance, this study that was done that I presented in urban slum area of rural and urban slum. Now, I can reanalyze only the data for the urban slum and write an abstract from that and present it in a conference. I can pick only the data from rural slum and analyze separately and present in the conference. Now, I can pick data from only the caregivers and write knowledge of malnutrition or knowledge of food insecurity among caregivers of under 5 in rural and urban slum. That is not food insecurity. Now, I've told you almost 4 or 5 things that would have been done from the same data sets that would give me different results, different objectives. So try to use that approach rather than submitting the same abstract that you have presented in a conference at another one. It is not good. Even for you present to learn from it, to write up and the like. So what exactly are you learning if you are presenting or sending the same abstract? Even some conference organizers, they will insist that you must submit abstract of work that has not been published or that has not been presented in another conference. However, some of them, they tell you that if you have published or you have presented, if it is still within the last 1 year or so, you can still submit. But most conferences don't want that. Now, I think the other part of the question is the time frame. What I will advise you to do, don't wait for so long. For instance, I have some colleagues maybe who are doing masters, PhD, or residency, and they have done their part 2. As soon as you finish your part 2, before you write your exams, you must have collected your data, let me say minimum of 6 months before the exams. I remember when I did my part 2, I think my last data collection was in September, and I did exam in April. So that turnaround time was very short. I had a lot of sleepless nights. That story for another day. So I want to assume that most people that go for part 2 exams would have collected their data. The last time they collected it, they will have maybe a year, even some like 1.5 years or 2. Now, by the time you are doing your exams, you collected your data maybe 2 years ago. By the time you leave it for another 1 or 2 years, people, the topic you have presented, it may no longer be topical, not relevant. Let's assume that when COVID-19 started, probably I did a study on COVID-19, prevalence or knowledge of community dwellers on COVID-19 in, let's say, Lagos State, Nigeria. Let's assume I want to publish that work today. I can assure you that no high-rated journal will accept that work for publication because it's not contributing anything. But if you do that study now, today as I'm talking, in Nigeria, among patients that tested positive for Mpox, and you're able to do that study on even knowledge alone, I'm sure that BMC Public Health will be interested in publishing your work. High-rated journal will be interested in publishing. So the earlier you get your data, please prioritize publishing. Most times, conferences like Affiliate conference, they usually specify that studies must have been done within the last 2 years. So some do not, but ensure you get your study published. That is no clearly defined timeline, but the earlier you can, the better. Thank you. Back to you, moderator. I hope I didn't miss any part of the question. Moderator, over to you, please.
All right, sir. Thank you, and thank you. I don't think you missed out on any of the questions. Okay, so with this, we have come to the end of today's webinar session. Like Dr. Elesomi mentioned, today was solely focused on research abstract writing. Hopefully next week, Saturday, we would be having a session on program abstract writing. So if you're a program or implementer, please, it would be nice for us to converge again and come to learn and unlearn and relearn. Yes, so with this, would like to appreciate everyone for joining today's session. As announced at the outset of this meeting, this webinar was organized by Plus-Circle Community Health Advancement Organization, which seeks to expand or improve the capacity of people in writing and research, and it provides scholarship opportunities as well, and updates on current happenings in the field of public health. So we implore you to follow us on our social media platforms, and would be glad to provide you with timely information which you need. In addition, we'll be reaching out to you via the email addresses that you have provided to send the link to this recording. As you can see, the webinar was recorded, so we'll send the link, but we'll not send the slide. Yes, we'll send the link to the recording. So please, let's keep writing. And I would also want to implore us rather that what we have learned today will go a step further to apply the knowledge, so that we don't just learn and then it's dormant. We need to apply it and see what progress we have made following today's session. So we appreciate you all. Thank you. It was nice having you on the call. Please enjoy the rest of the weekend. Thank you, and over. Goodbye, everyone.